Good morning. Welcome to this meeting of the West Berkshire Health and Wellbeing Board. I'm Councillor Graham Bridgman. I'm the portfolio holder for Health and Wellbeing, and I chair the board. And before we start, for members of the public watching, this meeting's being held in a hybrid format. So we have a quorum of members of the board in the council chamber. Myself, I'm joined by Vice Chairman Dr. Abid Irfan. I have councillors Dominic Burke, Lynn Doherty and Martha Vickers with me. And then zooming in and attending remotely are other board members and substitutes, including councillors Stewart and Masters, Superintendent Aziz, Mike Ferrady, Jessica Jundu-Evans, Gail Muirhead, Sean Murphy, Matt Pearce, Gary Paulson, Andy Sharp, Reva Stewart, and Kate Summers. And Katie Summers. And I think I've covered everything. I can see Kamal, just looking at my screen to see who else is here. So Kamal Bahir is here as well. As I say, the majority of officers and stakeholders who are presenting items on today's agenda will be doing so remotely, and indeed we have one member of the public who will be asking some questions, and she will be attending remotely. Meetings being live streamed via YouTube. Gordon Oliver is clerking the meeting and Kevin Griffin is the Zoom host. Members, you'll be pleased to know, I think, that we're going to dispense with all that standard Zoom reminder stuff. I think we've had enough Zoom meetings by now to know what we're doing. But if there's anyone new to this who's on the meeting, please let us know, put a chat, and we'll seek to assist you. So because this is a hybrid meeting, we will be having indicative votes. And what I'm going to ask those members who are attending remotely to do is use your Zoom hand for an indicative vote, and we'll lead you through that process when we get to that point. So, as I say, I hope you're used to Zoom and you know where your Zoom hand is. If not, get in touch and we'll point you in the right direction. So far as the agenda is concerned, you have received a supplementary pack, and there's one item to slightly amend, and I'm going to take the Building Communities Together Partnership Terms of Reference alongside when we get to the Domestic Abuse Board terms of reference. So we'll deal with those two sets of terms of reference under the one item. And finally, before we actually get on to the agenda, it's just after 9:30, and there's a scheduled fire and lockdown alarm for 10 a.m. So the bells will go off here, and we'll just have to pause while that happens. So let's start. Gordon, have we had any apologies?
Yes, we've had apologies from Charles Claridge from Berkshire West CCG. Katie Summers is present as a substitute. From Dom Hardy of the Royal Berkshire Foundation Trust. From Matt Hensby from Sovereign Housing, and from Meriden Peachy, Director of Public Health for Berkshire West, and from Andrew Sharp, Health Watch West Berkshire, and Mike Ferrady is present as his substitute.
Thank you. And I should note at this point that this was going to be Sharaz's last meeting, and there's going to be a change, and we'll deal with that in a moment, a change to Katie. But what I would ask is, Abid, if you could pass on the board's many thanks to Sharaz for her huge contribution and support over the years, I'd be very grateful. Right, members, those of you who were at the meeting on the 20th of May, do you have any amendments to the minutes that are in your pack? I see no one leaping up to make an amendment, so I will propose from the chair. Does that find a seconder? Thank you, Councillor Doherty. So indicative vote, if you recall, everybody, including those in the chamber, Zoom hand to indicate whether you agree the minutes. Zoom hands up. Okay, I think I've got enough of you to say yay, and since no one wanted to make amendments, I'm going to take that as a yes from the virtual group. So members in the room, we're going to lower your hands. We're going to do the usual physical hands piece for votes in the room. Members agree the minutes. Unanimous, thank you. And I will sign those after the meeting, Gordon. Right, actions arising from the previous meeting, members. There's a list in your pack. Now, I'm going to look through the numbers that are there. 151, that was with Andrew. Mike, do you know anything about this item, or is it still left with Andrew and Gordon to follow up?
I'm sorry, no, I don't know what the current situation with that is.
Okay, thank you. We'll leave that one then for Andrew and Gordon. 153, you can see that the peer review is to be progressed next year. 158, you can see that Health and Wellbeing won't oversee cultural heritage, and that action can be closed. 160, we're going to be discussing that later on in the agenda, but we're looking to complete that recovery dashboard by the end of this month. 161, that is actually going to be come up when we come to public questions. So I'll just hold that thought on 161 and we'll come back to it. 162 and 163, those have, as you can see, are complete and can be closed. 164 and 5, they're being progressed, and that they will be progressed alongside the development of the joint health and wellbeing strategy and its delivery plan. Members, are there any questions in relation to the actions log? No, let's move on. So declarations of interest, we have standing declarations of interest. Are there any other declarations of interest that anyone wants to make? No hands, so we can take that as a no. So we now move on to public questions. Members, we have 5 public questions. They're all from Paula Saunderson, and if she'll forgive me, I'm going to call her Paula because I think we know each other quite well now, and she should now have been admitted to the room. I'm just going to...
Yes, I'm here.
Thank you, Paula.
Can you actually see me?
No, your screen is...
No, I can't seem
camera
to
isn't on.
get the screen going, sorry.
Well, we can hear you, which is what really matters, isn't it? So I am going to take your first question. So if we can have that question up on the screen. There we are. Thank you. So, Paula, I said that we would look at this items 161 on the action log. So you can see that from the action log, the progression of that review of CHC in Berkshire West is with the CCG to come back to us for our meeting in December. So we will look at that overall question so far as this board is concerned in December. So far as health scrutiny is concerned, I simply make the comment, I made this comment at the last meeting of the executive, that I think it is very much for scrutiny committees to decide what they want to scrutinise. So I am not looking to interfere in anything that the Health Scrutiny Committee wants to do. And if they want also to look at CHC, continuing healthcare, that is very much a matter for them, but something I would be neutral on and look forward to seeing what they did, if they did it. So do you have a supplementary?
No, that sounds perfectly fine, thank you.
Thank you. Then we'll move on to your question B, which we'll put up on the screen. And there it is. Oh, yep, okay. And that Nikki Cartwright is going to respond to that one. Nikki. Is Nikki in the room, Gordon? Oh, I have it down as, I do apologise. I've got it down for Nikki. Katie, you're going to deal with this one?
Yeah, so thank you very much, Paula, for your response. I believe that you're in direct conversation already with Nikki Cartwright. She apologised that she can't be here today. but she really wanted to assure you that obviously and seek clarity for you regarding this question. So at the moment, to clarify, there is no national review of continuing healthcare, but Berkshire West CCG is reviewing the CHC functions, including a capacity review. So you should be already aware of that. There is no process for an assessment for carers within CHC, or I should say continuing healthcare. The continuing healthcare is a national assessment process and nationally agreed eligibility criteria, which is delivered locally, and every CCG is required to apply that national criteria and process. So to clarify, there is no standard continuing healthcare or definition within the continuing healthcare. The continuing healthcare assessment process is to identify the needs of the individual who require care, and there's no care assessment within the continuing healthcare process. Anyone over the age of 18 years can request a carer's assessment, or the CHCC team can provide details to the carers. So I'm hoping that's some questions to answer. Also, Nikki wanted to relay to you that actually as a CCG, obviously we're working very closely with the actual healthcare teams to provide training to support health and social care professionals in respect to their roles to the actual CHC process. There's checklist assessments and ensuring there is consent in place. There has been in place since the instructions of the CHC framework in 2007. And if professionals are unsure as to how to undertake any aspects of the process, the CHC team has a duty nurse who can advise. So I feel that actually we have got a clear process, but I appreciate you are directly in contact at the moment with Nikki at the moment. And as the chair said, obviously there's going to be an update about the process that come back to the Health and Wellbeing Board.
Katie, can I check, because I'm concerned perhaps that we've mixed questions B and C up. It sounds like...
That's a lot to take in under one question.
Yeah, it sounds like you answered question C, which perhaps we can just put up on the screen so that we all know what that one was.
Oh, right, sorry, yeah, apologies.
So let's deal with question C now, and I'll deal with question B in a moment. Paula, do you have a supplementary on what you've just received?
I'll have to listen to it back, but we know that there are breakdowns in the process that's supposed to happen. We've got tangible examples in our group, so maybe I should take those up direct with Nikki.
Yeah, I mean, obviously we're looking for a question there, but yes, if you could take that
Sorry.
up, that's fine.
Shall I take up our examples within the group direct with Nikki?
Yes, please do. So looking at question B, of course, to some extent, if we go back to B, please, Gordon. To some extent, I answered that in my answer, but Katie, do you have anything to add to the answer on, as it were, the answer we've sort of touched on B?
No, I don't actually. Obviously, the results, obviously, of the local application, obviously, will be coming back to the Health and Wellbeing Board. Nikki's overseeing this actual process. She's working very, very closely with obviously stakeholders as well as users regarding that review process. So I think actually it will be a really good update that can be provided at the October meeting.
Fine, I think that's December, but never mind, we'll sort that one out. So I hope that's A, B and C, Paula. I will take D and D. So if we take D, thank you, it's up on the screen. Paula, the purpose of the task force is going to be to provide a coordinated approach to the work that we're doing to address health inequalities. And something I would say about that is, of course, that if you recall the last meeting when we looked at the new strategy, I made the comment that health inequalities was a theme running right through it. And you'll appreciate that it's a very wide remit for that work. And therefore, not everything will sit directly under that task force. But the task force is intended to support the system as a whole, making sure that we've got joined up working and we get the communication right between the various group members and the wider partnership. So far as those living with dementia are concerned, they are an identified group within one of the priorities for the new strategy. And that is that ensuring the dementia pathway is robust is a strategic objective within the supporting individuals at high risk of bad health comes to live healthy lives priority. It's likely that the scope for that piece of work will sit with the Ageing Well Task Group in West Berkshire, and alongside that sit with the Berkshire West Dementia Steering Group system partnership, along with the CCG and the other two local authorities within Berkshire West, that's Reading and Wokingham. But what I would say is that we are in the process of reviewing governance in the light of the new strategy, in order to ensure that it is delivered in the best way. And one of those would obviously, as I've just said, be a fundamental, because inequalities is going to be a theme running through. Do you have a supplementary?
No, I've noticed that it is included in the strategy dementia, specifically on page 17. And I have faith in your process to ensure that the inequalities of it as a disease are covered.
Well, we obviously will be looking at the delivery plan in due course, which is going to be, it's all very well having a strategy, you've got to deliver it. And we'll also obviously be looking at the existing plan and its KPIs later on in the meeting. So watch this space. I'm now going to pick up question E, if we can, thank you, move on to that. My general comment in response to this question is that this is obviously a work in progress, because I'm certainly looking at the structure of the board and the structure of the various bodies that sit underneath it. And I doubt that we're going to end up with a structure chart that has the purposes embedded with it. I think it's far more likely that we have a structure chart, and sitting alongside that are a set of terms of reference that explain what each of those pieces within the jigsaw is going to be doing. We will look at the terms of reference, proposed terms of reference for the Building Communities Together Partnership and the Domestic Abuse Board later on in the meeting, and that'll give you a flavour as to where we're going with those, how we explain what's going on. So what's going to happen is that the Health and Wellbeing Board governance arrangements are going to be reviewed over the summer, and that's going to tie up with the new strategy and the delivery plan in order to make sure that we align the bodies that sit under health and wellbeing with those strategic purposes and with that delivery plan. As you know, we've already got some new functions. So Domestic Abuse Board is one example. Another one is a new responsibility for violence reduction. We had a discussion of that fairly recently. And as soon as we have bottomed all of this out and we have formed a new structure chart, I'll ensure it is published on the website, and those terms of reference will be published as well. So far as other boards that sort of fit in, partnership boards that fit into the Health and Wellbeing Board, I mean, those really, for example, the ICS, the ICP and so forth, that's really very much a matter for those entities to publish their own structure charts. But where they do, what I will ask officers to do is seek that we have a link into those, so that we have, to the extent we can, have one sort of central library of information on our own website. Do you have a supplementary?
Could that be included in the strategy or the delivery plan? Because the previous health and wellbeing strategy did have a kind of picture of all the bodies involved in delivering the strategy.
Oh, we certainly intend
to. And there's nothing in this one. That's feedback I've given on the document.
Okay. Well,
I just think it helps for pictorially for people to realise how many different bodies there are involved.
Oh, sorry, I fully appreciate that. And indeed, that's what I mean, that this is a work in progress. And I intend to end up with a structured plan, whether it's sitting as a formal part of the delivery of the strategy or not. I certainly intend to have one and have that published on the website so everyone can see it and link it to those terms of reference.
Right, great. Thank you very much.
Thank you, Paula, for your questions. And thank you. You're welcome to remain and watch us if you want. Right. Members, we now move on to item 6 on the agenda, petitions. Have we had any petitions, Gordon?
We have not had any petitions.
Okay, we move on to item 7, members. That's membership. As I anticipated, Katie Summers is replacing Sharos Claridge as the rep of Berkshire West Clinical Commissioning Group. And we also have replacement. Jessica Jundu-Evans is replacing Charlotte Hall as the cultural sector representative from the Corn Exchange. Please, these are simply administrative changes, please note. And you'll recall that when we had the discussion about membership of the board, we have aligned membership to position, not named individual, so that if someone changes within a position, we don't have to go through a whole vote to make that change on the board. So welcome both Katie and Jessica, and repeat my thanks to Sharos for her contribution. And indeed, I should say to the steering group, because it's not just to the Health and Wellbeing Board, and Sharos has contributed, it's to the steering group, to Locality Integration Board, to all sorts of different bits of this structure. So we now move on, members, to the Joint Health and Wellbeing Strategy and an update. This is an item to note, so we won't need to vote at the end, but I'm going to invite Sarah to provide an update. Sarah.
Thank you, Chair. So I'm presenting to the board today a paper giving an update on the progress in developing the new health and wellbeing strategy. As the board is aware, this has been in progress for a number of months now. The draft strategy is currently out for public consultation in West Berkshire, and this is for a period of 6 weeks, coming to a close on the 4th of August. We will then use the findings from the public consultation to further refine and finalise the strategy, and the final version is due to come to the Health and Wellbeing Board in September. During the period between now and then, we're also working on our local delivery plan. Although the strategy will be shared across ourselves, Reading and Wokingham, each local authority is developing their own delivery plan, which will detail how the strategy will be implemented in each area. In West Berkshire, we started this work with a workshop held on the 24th of June. The workshop had a focus on health inequalities and recovery from COVID-19. But the main part was a breakout room for each of the 5 new priorities, which asked the questions of what do we need to do locally to implement this priority? How can we measure our progress, and what indicators should we use, and which partners do we need to work with? Since the workshop, we've been further developing actions within the delivery plan, and we'll be using further engagement with the plan delivery groups and key partners and stakeholders in order to do this. This work is ongoing, but we're planning to bring the draft delivery plan to the Health and Wellbeing Board in September, along with the strategy itself. In addition, we're also in the process of reviewing the governance of the new strategy, and discussions have taken place with the ICP and Health and Wellbeing Board chairs for Reading and Wokingham to ensure that we can reflect the shared elements of the new strategy within each local delivery plan. But as already mentioned, this work is ongoing along with the finalisation of the strategy itself. But I'm happy to take any questions.
So members, do you have any questions? And what I will say, I'll come to you in a moment, Councillor Vickers. Superintendent, as is, if you have a question, since you haven't got a hand to raise, please just shout at us and we'll pick that up and listen to you. Right, Councillor Vickers.
Right, is that switched on? Yes. Thank you. Obviously, this has been quite a long process, and rightly so. And I believe the way we came to these 5 points that we've got here is through quite a lot of contribution from the public. And I took part in a few of those focus groups. So I know the process by which we came through to these 5 priorities. And it's interesting, considering what keeps being said, that top of the list there is reduce the differences in health between different groups of people. Because if I remember rightly, that seemed to encompass so much that was why this was put #1 priority. And I know the council has a big focus on this. My concern, as always, is how we get it out to the public, to the very wide, the members of the public that don't normally engage in these things, that the council is doing this, and that we really want them to know what the priorities of the council are, and we want their input. I know it's a very, very difficult issue, but are there any new ways in which we're trying to engage with the public? And are we aware of sections of the public that we seldom hear from? Are there new ways of actually getting into groups and individuals, and really partly to get their opinions, but also to inform them of what is going on here?
I would say that that's a big part of the new strategy, and indeed the delivery plan. And one of our particular objectives within that first priority is about speaking to and finding new ways to engage with our local communities, and in particular those groups that we don't normally hear from. As you say, that work has already started and is ongoing. We've got our new commission service with EduCafe, who's reaching out into different members of the community and different groups. We've also got our engaging and enabling communities work that is ongoing, and I think a big part of the inequalities work around COVID-19, and particularly with the vaccine, is around starting to build those relationships and develop trust with those communities, identifying community leaders. We're looking at developing a role of community champions, which will also help us to reach out into those communities that we, again, don't normally hear from. But I think there's a lot of work ongoing in that, most of which will be reflected within that new delivery plan as well.
And before I come to Councillor Burke on his question, I think I would simply comment, to some extent, we had a decent discussion about this, Councillor, because at the last meeting. And secondly, I think it is also incumbent on members to widen the scope. I mean, certainly personally, I've posted quite a lot about this proposed strategy and the consultation into local Facebook pages and so on and so forth. So I think as much as we can do ourselves to spread the message, but obviously when it comes through, there will be some very finite groups that we want to engage with, and we'll look at the delivery plan in that light when we come to it. Councillor Burke.
Thank you, Chairman. Thank you, Sarah. I want to start by saying I fully support these priorities. I'm slightly concerned, having listened to Councillor Vickers' contribution, where she stated that the first priority in the list is the highest priority. I look at these as being interlinked priorities, all of which will probably best delivered together. So I wonder if you could confirm that for me, Sarah, that these are not ranked in order, but they are equally important priorities.
Yes, no, thank you. I would agree with that. They're not ranked in order. They are all of equal importance. However, I suppose it is also worth saying that the priority on reducing the difference in health outcomes, although it is a priority within its own right, but we also acknowledge that it sits across the other priorities too. I wouldn't say that necessarily gives it a higher preference than the other areas, acknowledging they're all extremely important areas. However, it is just a realisation that work to reduce health inequalities sits across everything that we do as well. But we didn't want it to purely be a theme across everything. We wanted it to sit there within its own right as a priority to ensure that we're delivering on it in a targeted way.
As promised. Right, members.
Sorry, Chairman, can I come back?
Yes, of course.
Yeah.
Of course, Councillor Burke.
Okay. Yes. Thank you, Sarah. And I absolutely support your view that reducing the differences in health is something that's going to be delivered across the strategy. Indeed, the desire to equalise those differences is something that drives so many strategies in council through economic development, housing, etc. On a final point, which is somewhat pedantic, in paragraph 5.3, it says priority of reducing healthy inequalities, which I think should read health inequalities. And indeed, elsewhere, Chairman, in this paper, I think there are two other examples where I would have preferred to see health rather than healthy. I'll leave them to Gordon to track down. Thank you.
Gordon is looking forward to that task. Right. I see no one else wanting to. Councillor Vickers, you want to come back?
Sorry, there was another point I wanted to, a question I wanted to ask. And I was just wondering, these task groups that we've got, particularly the Health Inequalities Task Force, they've got really important work. And would it be possible for us to know who is actually on this task force? I know that these are all officer-led task forces. I mean, I have been involved in a few groups. I've been able to attend one or two, and I can see the hard work that goes on. But is that something that you think would be useful to know? And the community champions you've mentioned, I think, you know, as we've mentioned previously, using councillors to develop community championship in their wards would be good. And getting more input and making councillors feel more involved in helping to move this work forward. But could we know who is the membership on these task groups, particularly the health inequalities one?
From the chair, I don't think there's any issue with that at all. I don't think there's any problem with telling anybody who is on each group. I think to some extent I am looking to review, as I said more than once, review the bodies that sit underneath health and wellbeing, along with ABID, because this will be a steering group issue, to make sure that we've got the right bodies doing the right things in relation to the new strategy and the new delivery plan. This is, you know, we've discussed this on a number of occasions, but we've got to have a delivery plan which has set things to happen, and we need to know who is doing those things, and more to the point, who is making sure those things are being done. And have some KPIs. So we'll bring all of that out. That's for the future to some extent, but certainly there is no issue whatsoever in making sure that you're aware and anybody else is aware as to who sits on what. Members, anything else on this item? No, let us move on then.
Councillor Bridgman.
I do apologise, I've missed a hand. Councillor Stewart.
Thank you. So yes, totally to follow up from Councillor Vickers, I'm already a member of the Mental Health Action Group in my role as mental health champion, which is great. I'd also be interested in joining, if possible, some of the groups, in particular the Carers Strategy Action Group, because that is very close to my role in adult social care. So that was really just to follow on from Councillor Vickers' point there. Also, a point of order, I think. I think you said at the beginning, Chairman, that this is just for noting, but there is actually item 6, options for consideration, which are perhaps minor considerations, but it's actually around how far we go, I think, developing the plan now, whilst we're still in consultation with the general public and with our residents. So I just wanted to sort of have a conversation about that. And in particular from Sarah, who probably knows better than anybody on this, if we decide that we're going to go ahead and develop our plan whilst alongside, shall we say, the consultation, what is the risk that we might perhaps follow the wrong path in some of this work whilst we're still gathering that feedback? Thank you.
Thank you. And before I turn to Sarah, it may not surprise you, Councillor Stewart, I had actually considered that question and wrote a few notes. I wrote vote ? And circled it on my papers. But the conclusion I reached is that we are actually already doing 6.1 because work is ongoing in relation to a draft delivery plan in order that we are ready to hit the ground running. Now, if the response to the public consultation was such that it threw everything in the strategy and therefore the delivery plan into confusion and question, I think we would revisit everything. But because we have a plan which has gone through, sorry, not a plan, because we have a strategy which has gone through a number of public consultation processes to get to this particular public consultation, and because it has been agreed across 3 councils, we are going to need to take very great care if there was something that came out of the consultation that proved a particularly massive hit, if I can put it like that, on the strategy. So I think it is right to note that the work under 6.1 is already ongoing, and Sarah will correct me if I've got that wrong. And therefore, we are already undertaking effectively the proposal. It's not really, it's a note of the actions that have been taken by officers and what we're actually doing in practice. But I'll now turn to Sarah and see what she wants to say.
Yes, thank you. I would agree with all of that. I think it's worth noting that obviously the strategy was developed through extensive public engagement as well. And certainly the results that we're finding from the early results we've got from the public consultation that's ongoing at the moment is that generally people are really in agreement with the priorities that we have and the objectives sitting underneath them. We're getting regular kind of reports of that until it closes. And I see that the changes that will happen will be more around refinement and language and minor things that shouldn't impact, but obviously we will then review where we're up to with our delivery plans on the basis of the final public consultation results as well.
Okay, thank you.
So I think that on that reflection, I'm not going to take a vote on this. I'm simply going to ask members to note where we are and what is happening. Members, we now move to 2 sets of terms of reference. I will forewarn you that I have a slight amendment to propose to the Building Communities Together Partnership terms of reference when we come to them, but I'll take both terms of reference together after we have heard on the report itself. And I'm just checking, I think that's Jade. Jade should be here to talk to the report. Jade.
Hi, thank you. So as most colleagues will be aware, I have spoken previously at the Health and Wellbeing Board about the Council's duties, specifically relating to Part 4 of what is now the Domestic Abuse Act, following Royal Assent on the 29th of April. Part 4 refers to the delivery of support to victims of domestic abuse, including children in domestic abuse safe accommodation services.
Jade, could I pause you for a moment, please? Councillor Vickers.
I can't hear it very clearly. Is there a possibility of there's something wrong with sound per sound?
Jade, Councillor Vickers is finding it difficult to hear you. I can hear you, but I'm looking to officers as to whether
It's not very clear.
It may be your microphone, Jade. Just you'll have to carry on, and I'm afraid, Councillor Vickers, you're going to do your best there. If you turn round, you can see the transcript.
All right, thank you.
Carry on, Jade.
Okay, thank you. So the main focus of this report is that one of the council's duties under this part of the Act is for a domestic abuse local partnership board to be appointed for the purposes of providing advice to the authority about certain functions and aspects of domestic abuse. So in light of this, a domestic abuse board has now been set up locally by revising what was the quarterly domestic abuse strategy group meetings. The first domestic abuse board took place on the 17th of June. It went really well with high engagement from partner agencies. A draft terms of reference and procedure note has been developed, which sets out the new functions and requirements of the board to ensure all appropriate duties are being met under the new Act. The terms of reference and accompanying documents have now been seen by the Domestic Abuse Board, BCT Partnership and Housing Board. Some slight amendments were made prior to this meeting, but they have now essentially been brought to the Health and Wellbeing Board today for final sign-off. It is likely that the Domestic Abuse Board will develop over time as it is further implemented, but the terms of reference at present are an accurate reflection of its responsibilities going forward. So on that note, I'm happy to take any questions.
Members, before I see whether or not there are any questions, let me just clarify where we are with both the Domestic Abuse Board terms of reference and the BCTP terms of reference. The Domestic Abuse Board terms of reference follow a pattern which I have asked officers to follow in order to try to get some, and you will have heard me say this before, commonality between the terms of reference. Indeed, right from the top, working down through the council's constitution, we're going to be trying to get some commonality between, as it were, terms of reference for the various committees of council, Health and Wellbeing Board being one of those, and then move on down into the various subgroups and sub-subgroups. For those of you who aren't in the room, that was quite a bit of feedback. So the Domestic Abuse Board terms of reference came before the Domestic Abuse Board. The Building Communities Together Partnership terms of reference came before BCTP, but that was fairly late in the day, which meant that they weren't on this agenda originally. I said they needed to be on this agenda because there was no point leaving them yet another couple of months before we've had a chance to look at them. I am proposing one amendment to the BCTP terms of reference, and it is this. The CCG is actually a responsible authority. When you look at the Crime and Disorder Act and look at the list of responsible authorities, CCG is one of them. So it should move up from being an other partner in the list to becoming a responsible authority in the list. That is the only amendment that needs to be made to BCTP. Both sets have been drafted on the basis that this board agrees them. So if you look at the dates in the draft, they are both anticipating agreement. So I am now going to invite any questions on these terms of reference before I move to a vote. I see no one itching. Councillor Vickers.
Thank you very much. Obviously, I welcome this sort of raising the profile of domestic abuse. I mean, this council already has a domestic abuse strategy board. So I suppose, in one sense, one of my questions is, which seems to function in a similar way to what's being proposed here.
Councillor Vickers, this was discussed at length last time.
Okay.
That
was not my question.
The new domestic abuse board is the previous board.
I understand that. I understand that. So my question is, there's a lot of money that is being put into this. So my question is, which was related to what I've just said, is, and the money is not ring fenced. So my concern would be how we are to be reassured that the money, the extensive amount of money that is being put by government into this important work is going to be used for this work, the sort of feedback we will get, where and how, and whether this committee itself can propose that the use of this money and how it is tracked is something that, again, itself is referred to health scrutiny, so that we can keep a constant scrutinise ourselves on how well we are doing in keeping high standards as regards domestic abuse and meeting the needs of people in our community on an issue that we know is of increasing concern, has got worse during the pandemic, is likely to get worse, is hidden. There is so much that can be done, and I'm sure there's good practice that we can take from other areas. So this is money that I would hope will be used on domestic abuse and not lost, and how we can be sure that we are keeping a high standard in using this money can it be used to extend refuge placements? I mean, I'm not sure what the extent of using this money is.
Let me say two things. Firstly, as I've already said, what health scrutiny decides to scrutinise is a matter for health scrutiny, and I'm not going to interfere or seek to point them in any direction. That is very much a matter for that committee. So far as the Domestic Abuse Board and the money that the government has provided, and indeed provided in anticipation of the bill as it then was passing into law. So we actually were sent money before we had a duty, on the basis that we would anticipate that we would have a duty and need to carry it out. That spending of that money, my recollection, I'm going to turn to Jade in a moment, is that it was fully and comprehensively detailed in the paper that we looked at in this board at our last meeting. But I'll now ask Jade to comment.
Yes, that is correct. And I have been keeping track of the money, and we have to report back to the MHCLG at the end of each financial year to advise how that money has been spent. So they will have sight of that as well.
Thank you, Jade. That answers your question, Catherine. Thank you. Right, we'll move on to the vote then, if no one else has anything to. So I'm going to take them in order because I think we have to split them. So I'm going to take the Domestic Abuse Board terms of reference first and ask for a raised Zoom hand indicative vote of those in favour of agreeing these terms as they are in front of you on the second pack. Those in favour, please raise. That is a Councillor Vickers, you voting? That is a yes. Councillor Masters? Thank you. That's a yes then. And now that seems to be unanimous of those in the room and virtually. So I'm now going to look to those in the room to indicate whether they agree the terms. Sorry, I should have looked for a seconder for that. Can I have a nod from the Leader of Council that she seconds that? So that is passed. And we'll now move similarly to BCTP terms of reference again. Indicative vote, raise hands, please. Okay, I see again looks like a unanimous vote of those of the board. Please lower. And members in the room, I again propose. Councillor Doherty, no doubt seconds. Thank you. Those in favour? Passed. Thank you. Let us move on. This is next item 10 is the dashboard, and this is a to note item, so we won't be voting. April.
Thank you, Chair. I'm just going to share my screen. I've got a very brief presentation just to share with you. Good morning, everybody. Just to take you sort of through the presentation. So today I'm going to be talking to you about a recovery dashboard that is in the process of being developed to sort of measure the impacts of COVID-19 pandemic across the life course. So you may remember about this time last year, Holly Jenkins within the public health team led on a piece of work to identify the impacts of COVID-19 across the life course. And we did a really good piece of mapping work to identify what all those impacts were. So we've got sort of short-term impacts, medium-term impacts, and longer-term impacts. So sort of really to build on this really good piece of work that was done, we felt that it would be good to put together a dashboard to really help us measure what's happening within the area, and the recovery dashboard will monitor the health and wellbeing impacts of COVID across the life course. So it's really building on the work that's already done and identifying who is most at risk at a particular life stage. So it will feature each identified life stage and the relevant data that is available to monitor the identified impact. So the data sets will look back at the position prior to the pandemic, during the pandemic, and then will also help us monitor the situation going forward. So progress to date. So we've started to look within the public health team locally at what data is actually available to help us monitor some of these impacts that we've identified through the poster that I just showed you previously. And we've been able to identify a mix of both national and local data sets. So that was our sort of first step, working with the public health leads within the team to identify what data was available. I think we found about 78 data sets that we could use in this dashboard to monitor those impacts. So having sort of identified the data, the next step was to have a discussion with the Berkshire Public Health data team, because we wanted to see whether we would be actually able to put a dashboard onto the Berkshire Public Health website. So after discussions with the team, it was felt that actually a dashboard that looked at recovery and the impacts would not only be useful for us in West Berkshire, but would also be useful for other local authorities across Berkshire. So as I've said, it will look at both national and local data. So as the dashboard develops, it's going to be sort of divided into two phases. Phase 1 will be uploading of all our nationally available data. And then as we've got that process bit of it done, then we'll move to inputting local data as well. So what we'll find is that each area within Berkshire will have their own dashboard recovery report. And so some of the local data that we may have in West Berkshire might be slightly different to other areas' local data. So there will be sort of nuances in the dashboard. So the data sets will be comparative. So when we look at data, we will be looking at how we compare to both national averages and also to the Southeast. And we'll be able to see how we compare across different data sets with our neighbours across Berkshire. So I think the data sets will be really useful because they will be able to help us identify trends over time, monitor progress of recovery, and really help us to identify where action is needed. As part of this work, we will be trying to identify the health inequalities as we do this work. And so we'll be looking at viewing data, inequalities data by ethnicity, age, sex, and deprivation where we can. We're not able to do that with all the data sets we've identified, but we will be able to do it with some of those data sets. As a result of having this dashboard, this will help drive our recovery action plan as well. So that drive the work that we're doing, we'll be able to look at where we need to focus our work. And there will be an action plan that will sit alongside the dashboard. We'll also be able to measure the impacts of our actions. So once the dashboard is completed, it will be located on the Berkshire Public Health website. I'm sure some of you are aware of the COVID dashboard that sits on that website currently. So that gives us all our daily information around COVID. So we felt that it would be really appropriate to place the recovery dashboard in the same place. So when you go onto the website, you will be able to see a landing page for the COVID recovery report. And as you'll see there, it's got all the local authorities listed, and then you'll be able to click on which local authority you're interested in looking at. And then that will take you through to a COVID recovery report for West Berkshire. When it's finalised, you'll be able to click on each of the parts of the life course. So you might be interested in looking at the pregnancy data that we have available, which will help us monitor the impacts in that period of time. So you'll be able to click there and see all the indicators that we have listed and all the trend data. And similarly, you'll be able to do that across the life course. So that's really the concept of the dashboard. We're hoping that it's going to be completed towards the end of July, early August. So it still is work in progress. And as I said, from the time that it becomes available for public view, it will be an ongoing piece of work, and we will be adding to that dashboard. To begin with, we think that the data sets will just be available there, but we're hoping over time that it will be possible to put information around those data sets as well, so that the data becomes understandable and it's easy to see what the data is telling us. So that's everything that I have to say on the dashboard at the moment. But if anybody has any questions, I'd be really happy to answer those.
Thank you, April. I would say, and I said this both I think in this group, and more particularly in Local Outbreak Engagement Board, that Berkshire Public Health website and the dashboard is a very useful source of information regarding COVID. And I also want to personally congratulate you and the team for the work that's gone into this. You know, we are leading and the rest of Berkshire is following, and it's good to see. I know that original graphic that you showed has been shared very widely nationally indeed, and congratulations to everyone who's been involved. So members, is there anyone? Katie?
Thank you, Councillor. Yeah, April, this is a fantastic dashboard, and I was very aware of the life course piece going forward. On the data sets, some of the data sets are actually ones that are reported on a yearly or monthly basis. How are we working in order to get through some information which would be more relevant on a monthly basis? Some of that might be in relation to some of the healthcare provided services, because I think that's what we've got to be doing. It's just understanding about how we could incorporate some of that data if you're not already looking at that already.
Thank you, Katie. That's a really good question, and I would be really keen to discuss what other data that we might be able to put into the dashboard. So yes, if I would be able to have a sort of conversation with you outside of the meeting regarding that. I think we want this dashboard to be sort of really live, timely, and as useful as possible. So once it goes live, if there's other things that people think would be useful to include in it, we'd be really happy to have that conversation about that.
Okay, I'll speak to you directly outside the meeting, April. Thank you.
Councillor Vickers, did I see you put your physical hand up?
Sorry, I am using my physical hand. I'm sorry, the flitting between the two is a bit problematic. Yes, I mean, I'm sure this has probably already been done, but I'm just thinking whether this is a useful thing to be making sure our towns and parishes are aware of this dashboard, whether they can be them more aware of what's happening in their own communities, or are we? I know anybody can access this information, but are there certain things that we think we might alert towns and parishes to actually be aware of this information?
Thank you, Councillor Vickers.
April, before you
sorry.
No, I was simply going to comment that we are doing quite a lot of work on community engagement, and the information flow on this and many subjects is being discussed. I think Leader and I have got a meeting in a not very distant future to discuss that whole piece of community engagement. So certainly that will be on our agenda. But April, what do you want to say?
Very similar. Thank you, Chair. Just to say that, yes, there will be lots of communications around this once we're able to go live with it. But really on that point is just to say one of the reasons that I wanted it to be on the Berkshire Public Health website, so that it could be available to everybody, so that it's not just a professional document, that anybody can go on to it. Our residents can have a look and see what's happening across a range of indicators. So, and I think we've wanted to do something like this for quite a long time. So I think it'd be a great step forward to for all our residents to be able to view our data.
And Abid.
Yeah, thanks, April. I think it's really good. I agree with that. And it was really just linking it back to the kind of health and wellbeing strategy and the kind of plans from there. I suppose a lot of these data sets, there's quite a lot of crossover. So we'll be able to use those to track the kind of health inequalities piece and various other actions against the 5 categories. So I know we haven't got to that yet, and we're working on the draft plans as discussed earlier, but I suspect that's what we're going to do. So we have one set of metrics which covers both kind of.
Yeah, absolutely. And I think so this dashboard will be really helpful to monitor the work of the new health and wellbeing strategy, and also our recovery and renewal strategy as well. I think it has a sort of a multi-purpose approach, really.
And Councillor Doherty.
Actually, picking up on that second point, April, was very much how do we translate the data into delivery? And I also wanted to echo Councillor Bridgman's comments at the start, because I think people have got really used to this dashboard over since it was launched. I think it was last year, Matt, I'm looking at you. But I think it's where people go to now to look at our COVID numbers and lots of different information. So I would also like to say well done to the public health team for pulling this together and making this available and very open and transparent. But I am interested in your thoughts around how we prioritise and how we take that data information into an actual delivery. So we've obviously had earlier today the strategy coming forward, which was the strategy we've all been working towards, but there's obviously going to be items that perhaps come out of this data that say, actually, we need to not necessarily stop, but we need to prioritise particular areas. So how those two things will sit alongside in terms of delivery and prioritisation, and will they then come back to the Health and Wellbeing Board for this board to make those types of decisions? I think that's what's very the same as Dr. Irfan, that it's how the two work together that's in my head.
Absolutely, and I think the key thing is that within public health, we're always saying that the data should and the evidence should be driving our action. So I think this is a really good step forward in having all that information and being able to look at what the data is telling us. Quite often I'll get asked questions about what's happened to our physical activity levels, for example, as a result of the pandemic. So having these data sets, we'll be able to answer those questions more fully and effectively by being able to have our data all in one place and to actually see what happened prior to the pandemic, what's happening now, and be able to monitor that going forward. So absolutely, I think the data should be fundamental in driving our delivery plans going forward.
And Matt, you want to come in as well?
Yeah, thank you. And thanks, April. It's a really good piece of work. It's really good to see the infographic kind of come to life, I think, because we did that possibly, I think, in the middle of last year. So it's just a few things. I think Katie made a really good point, because a lot of those data sets do take a long time to update. So I think, Katie, it'd be really good to have a conversation about how we could use population health management data sets to get that real-time information, whether we inform that onto the dashboard, but it'd be really good to have that conversation. And I think, yeah, just what Councillor Doherty said, I think it is about how this data informs what we do as priorities, which might change over time, but then also how we monitor the impact over time. So it's those two things. And then the last one I think we just need to remember is how we hold on to that community voice that complements the data, because obviously the data is that kind of deficit approach to public health, but actually there's lots of really good things going on in the community. And I think that's really how, when we're developing our delivery plans, how we marry up those two together, so we kind of build on the strengths of communities as well as kind of maybe what's not working as well. So it's just those observations.
Thank you, Matt, and thank you, members. Well, that was an item to note, so please note. And we now come on to another item to note, which is the delivery of the Health and Wellbeing Strategy 2021 and quarter four. I'm going to make some comments on this before we move on to discussion and questions. I think we discussed last time that the previous strategy and delivery plan ended last March, so March 2020, and we needed a new interim delivery plan between that previous strategy's delivery plan and the new strategy that's coming forward that we've discussed earlier, and the delivery plan that will come alongside that. The spreadsheet you've got in your papers is a simplified version of the one that we've presented at previous meetings, and provides a RAG rating for each of the key performance indicators and where that KPI has an associated target that can be assessed against success or non-success. All the KPIs have a narrative to support further information about how we're performing. Now, it goes, I think, without saying on this and on so many things that to say performance has been affected by the pandemic is an understatement if ever there was one. So many of the initiatives in the report have been suspended, stopped, deferred, but there are instances, and many of them, where there has been success and whatever was promised has been achieved and targets delivered. Now, because this is a report at the end of quarter four, there are no ambers. Either something was achieved or it wasn't achieved. So where it is RAG rated, it is either red or it is green. But it is worth noting that some of the reds were only slightly short of their targets. And I think when you put it into context of the pandemic, that isn't a bad result. Health and Wellbeing Board Engagement Group has been asked to look at preparing a summary of what we have achieved through this strategy and delivery plan for the conference that we intend to hold in October, where we will also obviously be talking about the new strategy and the new delivery plan. And it's intended that that report will focus on the outcomes to demonstrate whether the board has been effective and how effective its subgroups and partner organisations have been. So the proposal now is that we defer further performance reports until we have the new delivery plan adopted and a new set of deliverables to have targets and KPIs around. Now, obviously, a number of these strands may well find their way in one way, shape or form into the new delivery plan. And Sarah in particular and her team will be reviewing this plan to see what needs to be retained or carried forward. There is a question of having alternative tools for tracking and reporting. And certainly the steering group has been keen to see more narrative in future reports because we felt that there was a limited range of KPIs and that might not actually reflect the full breadth of the work that's going on across each of the subgroups. So that's where we are. You have the report in front of you. I have some specific questions I'd like to raise before I go to the floor, as it were. So if you'll bear with me, I've marked my paper copy up. So questions, if I give them to you, Sarah, and you can then answer them as one block, perhaps. Now, I understand, of course, that this delivery plan is predicated on what was the existing structure of health and wellbeing and its subgroups. So, for example, a whole load of the, I think it's the bottom 5 targets under building a thriving and sustainable environment in which communities can flourish. Unfortunately, my copy isn't, it's page 67. They are now, there's a whole load of stuff there about domestic abuse, which obviously will now be, if they continue, and obviously domestic abuse board will need some targets and some KPIs to assess, they will presumably go to domestic abuse board. My question was the one above those 5 is develop and adopt a serious case review protocol by December 2020. And it appeared to be to the housing strategy group. And I didn't quite understand why that wasn't building communities together, because certainly the discussions I've been involved in about serious case review have taken place in BCTP. So that's my first substantive question. And another one, I think, bear with me, I've got to remind myself. Delivering public engagement talks about multidisciplinary team meetings, and that is linked into the health and wellbeing engagement group. Now, I understand the engagement group would have a role to play in getting that message out, but the discussions again that I've seen going on about MDTs have been in integration board, locality integration board. So again, I'm just wondering how that sits alongside LIB. So those are my couple of questions. If I can ask you, Sarah, to look at those first, and then I'll go to members to see if there's anything else. Silence. Sarah disappeared off the call. Gordon.
I was just going to say that there may have been some slight errors crept in. We adapted the form slightly from the previous version, so it may be that when some cells were merged, that a certain indicator flipped into the wrong group. So I may have to go through and just review that again. But
okay, well, I'll leave that with you, but I'll also, Matt.
Yeah, so it's just to add, Chair, that obviously Sarah's primary role is to lead on the new strategy and the associated delivery plan rather than the existing one, just to let her off the hook on that one.
Okay, well, members will take those questions away and look at them outside the meeting. Do members have any other things they want to raise on this? Councillor Vickers.
Thank you, Chairman. I'm just looking at the table, Health and Wellbeing Strategy Delivery Plan, which you referred to, and I assume the action where it says supporting children and young people at an earlier stage, ensuring they are safe through prevention and early intervention services. Would you say that this is because the sort of lack of information there is obviously a bit worrying? Would you be relating that to COVID and the inability to possibly take those actions forward? Because that's obviously quite worrying that, you know, that there's no information there. And the other point was related to the action in schools related to the delivery of life education performances. This comes under the substance misuse group. And we've actually got some statistics there, which it's really nice to see on a small matter that, you know, you've got a delivery and you've got what seems like a good response from the children that participated in this activity, which looks like a reasonable response. And it's just good to see something specific with a response. And I hope that that work is still continuing and going forward and isn't threatened in any way.
I am going to suggest whether Andy or Matt are best to come back. Because Andy, regarding children's, I think obviously I've got the portfolio holder next to me as well, but I'll look to you as the officer.
That's fine, and yes, just to provide that reassurance, that work will continue. It's part of the ongoing programme of work within the directorate.
And next I have Councillor Doherty.
Thank you. Actually, it's probably a question more for Gary.
Sorry, Karen.
Am I right?
No, Karen.
But Gary, I note the comments around the suicide prevention work and the issues that have gone on from COVID, but I also note the grant for the outreach. And I was just wondering, obviously, that this is quite a critical piece of work, I would have thought at this time. A little update, do you mind?
Yeah,
just where we are. Thanks, Gary.
Yeah, I was going to put my hand up actually. The red box we've got in terms of running events to raise awareness of suicide is probably the wrong measure now, because we appointed the suicide prevention outreach worker last December. And so rather than running events, what we've actually had is somebody out there doing that outreach work. Now, obviously, it's been very difficult because we've not been able to physically knock on doors and go into businesses, although we've been doing literal letterbox drops of resource materials. In the same time, we've also launched the website, which is going very well. The interaction with that website now is great. In fact, if you were to Google suicide and help and West Berkshire, Newbury and Thatcham, it would be first hit now. So that's turned out very well. So probably this is a way I've not communicated it very well with Gordon actually, but that box really shouldn't be red, it should be green. And in fact, I had a supervision yesterday with our outreach worker, Sue, and she's now actually literally, it's only one day a week, by the way, you know, it's only 8 hours a week and she's doing sort of 2 lots of 4 hours. So she's physically going to businesses where appropriate and giving information. And we get some really lovely feedback now that the resources are being used. And we also done a suicide prevention training day as well, I think just over two months ago. So it's actually very active on very little money. I mean, it's I think 7,000 quid or something. So we are doing things, but now we're being told it's okay to be out there, then the physical contact with businesses we stepped up considerably.
Thanks, Gary, because I know we've spoken and I was aware stuff was happening, so I was surprised to see the red too. So thank you for that clarification.
Yeah. Okay.
Members, apologies. I was just reading a note that has been sent to me, so I apologise for that. I'll come back to that in a moment. And I think, Gary, I would simply reflect that, as I said at the start, to say that the pandemic has driven a coach and horses through all sorts of things, including targets for performance and visits and so on and so forth, is an understatement. So, yeah, I think we all reflect on that. Yes, members, I do apologise. My briefing note doesn't have item 11 on it. Yes, Gordon. He looks aghast at me. Kamal, I do apologise. You probably wonder what on earth was going on there when I jumped straight past your item. Yeah, I missed it because it wasn't there. I didn't even notice that 10 jumped straight to 12, so I apologise for that. Kamal, can I ask you to present?
Thank you, Chairman.
So, Kamal, before you, I do apologise. I thought Councillor Doherty has what we're now calling a legacy hand, but it turned out not to be a legacy hand. It turned out to be actually a second hand. She just hadn't taken the first one down and put it back up again. So, yeah, Councillor Doherty, you have another question.
I do, sorry. It's on page 71, and it's the one around the delivery of public awareness campaign to promote the sustained employment of people from underrepresented groups. I don't think we've actually got Ian on the call, and I don't know if we've got education represented, but there was talk about an awareness campaign and the fact that this has actually been delayed due to COVID. Yet in my mind, this should be one of the top priorities because of COVID and shouldn't actually be delayed because we know that, COVID has impacted people unequally, and we know we're doing lots of work ourselves around sort of trying to get things like Kickstart for young people, etc. And I just wanted to pick up that I understand that COVID has had an impact on some things, and I appreciate that, but there are things that probably should be almost prioritised because of COVID. And for me, this particular measure is one where we really need to be doing something about it now, regardless. It actually brings it up to the forefront rather than down. And I haven't got anybody, I can't see anybody from education here. And I know working with the LEP, we're doing a lot around this skills piece and what we need to make sure we're making sure people are adapting their skill set and everything else. I'm just really concerned about that particular measure, Councillor Bridgman.
Well, I'm going to invite Andy to come back on that.
Yeah, thank you for that. I think it's a fair comment, Councillor Doherty. I think we do obviously need to put some focus into that, and perhaps it would be helpful if at a future meeting this board, colleagues from education could come along to have a discussion about the things that we're doing around that. There are some proactive work being undertaken at the moment. We've put some additional capacity into some of the activities to support that, but I take the point entirely, and it is one that we would need to promote as we come out the other side of the pandemic. I would completely agree.
Right, Councillor Jones.
Sorry, just to expand on that, I noticed from that was one of the actions from the Skills and Enterprise Partnership, and I guess the pandemic just affected the leader of that group in terms of the college, which was being used to pursue that, perhaps in a slightly narrower bandwidth than you're referring to. So I think maybe that was, in the future, if we are expanding that should perhaps be reassigned to a different function.
Thank you. I think that has exhausted that discussion, and as I say, that was to note. And now we can, at long last, go back to item 11. Apologies again for missing it. Kamal, over to you.
Thank you, Chairman. So just for those who don't know me, I'm Kamal Bayer. I'm the chair of the Health and Wellbeing Engagement Group. And one of our roles that we originally set out was to coordinate, collaborate and communicate with our residents. And it's a constant battle to try and make sure that we're reaching our residents. And one of the reasons the group was set up in the beginning was to try and engage together as partners and members of the board, and to reach our residents once, rather than have engagement fatigue by going back again and again through various routes. So there's still quite a lot of work going on at system level to look at how we can coordinate and make sure that that's happening on a more joined up approach, shall we say. And from a board's point of view, I'm here to talk about what we're doing specifically to raise the awareness of the work going on here. So we've developed something that we're terming a communication toolkit, which is rather a fancy word for an Excel spreadsheet. but I'm going to just quickly share my screen, if you don't mind, just to give you a little bit of a flavour of what it is. So basically, we've tried to look at the different groups that we're trying to connect with, and and who we are reaching and what are we doing trying to reach them. And this toolkit is just pulling together all the Facebook groups that we've got in our area, all the parish council representatives, all the national campaigns, and then setting out the schedules. And the aim is to try and populate that with all the public health awareness campaigns that are going on, CCG, council, anything that is pertaining to health and well-being that we can put together that then can produce a shared resource. In the pack, there was a graphic. I'm just going to flash that on screen just so that you've got some visibility of the kind of style that we're looking at. So we've been working with a company as part of the bid, the priority bid that the group received in December. We've been working with a company to produce some graphics to look at reaching. Originally, it was looking at those with greatest health inequalities, but I think it's going to be a broader reach now. And we've managed to procure 40 sets of graphics, and each one of them will have a specific topic area that they're pertaining to. And that area may have 4 or 5 slides with lots of associated images and wording with it. I'm just going to scroll down. These are just some examples that they've put through for us for styles and different ways of presenting the information. And I asked them to highlight what all the different subgroups were and what they're all working on. And so hopefully when we can update this and make this live, it will answer some of the questions that were being raised earlier. What are the subgroups doing and how are they reaching the different audiences that we're trying to? As always, please can I remind you that we've got an Instagram and a Facebook page, and could you share them? And then in our Health and Wellbeing Board conference, we normally ask the subgroups to highlight their work. Last year, we had a carousel which had the top 3 items that each group felt that they did well on, and that was available for everyone to view. This year, I think we're going to do a video. And we're meeting with the comms team to try and have a look at how we can develop that. So there's lots of work going on in the background. The reason for bringing it to you as the board today is to have a little bit of a call to action, really, and to ask you as board members to support and engage with this through your organisations. Who should we be linking into? How can we work together? And how can we ensure we amplify the messages jointly? We're trying to do that internally in all the organizations and make sure everybody's working together. But if you've got specific individuals who are doing this for your organization, I would like to link in with them and also to provide this resource when it goes live. Just to mention one thing that is probably relevant, Gordon's been producing an induction pack for the Health and Wellbeing Board. And in parallel to that, he and I have been trying to develop a public-facing information pack, if you like, around the Health and Wellbeing Board. And then some of the questions that were being raised earlier in the meeting will hopefully be able to be addressed with that. Matt.
Thanks, Kamal. Really, really great. Can I just clarify? You're obviously talking about resources. Is this an online resource? Because I think it'd be really great, won't it, to link the recovery dashboard, the observatory, and all the work the board does. I think that'd be really, really good to kind of get the message out there about all the great work that's going on, but also that the community are doing. So I'd really support it. So that sounds really good.
Yeah, thank you. I think the aim, because I want it to go to as many people as possible, and it would be a free resource, but obviously we would need to control membership in some way. I'm looking at inventive ways of being able to share it, and that might be through our Facebook page, where we have a closed community area and we can have the resources on there that people can draw on, but we're still exploring that. We're hoping to go live in the autumn, and I was trying to coincide that with the Health and Wellbeing Conference. But it's really a question for the board. Are you happy with me taking this approach and really working on it iteratively so that we can continue developing? And so we start in September, launch in October at the conference, and continue to work with everybody to populate it and make it as rich as it could be.
Yeah, from the chair, I think I would say that if health inequalities was the theme of the last meeting, engagement with the public is probably the theme of this one. It's a theme that has run through a number of the discussions. I personally have absolutely no issue at all, Kamal, with what you've just proposed. I think I look forward to getting these umpteen bits of the spider's web joined up, because as I've said, we have these various groups sitting underneath health and wellbeing. We need to make sure that the public understands what they're out there to do and what we're doing, and make sure that we are delivering the strategy through the delivery plan. And all of that can start to get tied together at the conference. So a date for your diaries. I think we have public. If we haven't published a date yet, we certainly will do so. Councillor Vickers.
Thank you. Thank you for that. That it's very encouraging, all the hard work that seems to be going on to try and get out there and engage with people. Visually, I thought that document really caught the eye and was very clear. I quite liked it. I suppose so far, this is only just starting, but obviously it would be good to know what sort of comeback you're getting, sort of who's responding. And I know social media is the way to go. But obviously there are still people that don't connect on social media, and that's the hard bit about how you communicate with them, and whether there are ways of contacting in-person groups. And there's so many ways that one needs to communicate with people, and hopefully we won't miss out on those that aren't engaging on social media, and try to get younger people involved as well, any groups that are dealing with younger people, because the sooner we can be making them aware of what's happening and the importance of all these issues, and getting them feel that their comments are important, and and that their health is something that they can actually be part of and develop things in the community, then I think get to young people as soon as we can. Thank you.
So do you mind if I just pick up on those points? I've forgotten what the first one was already. I'm sorry, I've got a builder drilling outside, and my brain's gone. But the second point about young people, I'm linking in with Pete Campbell and the engagement group, looking at what we can do for bringing all the engagement around young people together. Matt's linked me into the campaign, which is Be Well, which is across the whole of Berkshire, I believe, looking at young people and how we can help their health and well-being. And that's going to be launched in September. So there's lots of activity going on. It's really about bringing it into one channel so that we can feed it out to our residents, really.
Sorry, Kamal. The other point was about not just communication by social media, which I know is hard.
Yeah, non-digital. So what the aim of that is to continue with the article that we have in the Newbury Weekly News. Now, the problem we've got with focusing on one newspaper is that once I give them the article, it becomes their copy and I can't share it. So I'm trying to work with the comms teams to produce a brief that can be a press release, and then that will go to everybody, and we will share it with parish magazines as well, so that it can try and reach the local magazines as well as the specific areas.
Can I just ask, do we have any ways of communicating with residents' associations in our sort of so-called community groups in our deprived areas? So is there sort of any direct link there, or is that these are?
Yeah, we're looking at all of that and mapping it onto the toolkit as to the people who we're going to be linking in. So that will all be on there.
And Sean.
Thank you, Chair. I was just going to say, actually, I thought that looked excellent, Kamal. Really, it was just not a question, it was an offer. So my own service, the Public Protection Service, have done a lot of work around communication, particularly linked to kind of priority themes and priority areas, and a kind of blended approach to that. So I was really just going to make the offer that we very much kind of welcome the opportunity to kind of work with you and help you kind of help each other to develop some of this stuff, if that would be helpful. So I'll contact you after this and get some details over to you.
Thank you.
I knew there was a reason we invited you to join the board, Sean. Well done. Let's move on, unless there's anything else anyone wants to raise with Kamal. No. Okay, so next item on your agenda, ladies and gentlemen, is ICP transformation. This is a verbal item from Andy Sharp, and then there's, I think, some other issues you want to raise as well, Andy, as part of this item. Over to you.
Thank you. Hopefully, colleagues, you can see my screen. So just a couple of slides just to support the verbal item. So this is an update from the work around the ICP for Berkshire West. At the most recent meeting of the Unified Executive, we focused on a couple of areas of interest, I think, I just want to pick up with the board today. So one is around rapid community discharge. This is the piece of work that's been undertaken through the pandemic to ensure that people flow out of hospital as quickly as possible and we don't get delayed transfers of care. We've been very successful across Berkshire West in managing flow throughout the pandemic, and we want to try and maintain the benefits of that piece of work as we come out of the other side of that pandemic. So there's been a piece of work through the UE to look at how we can do that, to mainstream the work that we're currently doing and to core fund it through the budgets across the health and social care system. There was a paper that came to the most recent Unified Executive that outlined the benefits of the current approach, but also underlined the fact that it's costing around 900k per month to deliver the rapid community discharge programme across hospitals and within social care through all the different facets that are part of that programme. Obviously, there are savings attached to the way in which this flow works in terms of keeping people out of hospital beds for longer periods, and some of that is captured within that paper. But there was a recognition that we've got central government funding and local funding through the CCG to cover the first half of the financial year to allow us to carry on working the way that we are currently working, but that funding is scheduled to run out. So there is an ongoing discussion about how we core fund it. We've agreed with the CCG that we'll carry on funding the programme through to October of this year, so we'll extend the arrangements. But we do need a longer term decision across the system as to how we will manage this. So there's an intention to bring that forward through to the Unified Executive at its next meeting to consider a further business case. At the moment, things will continue unchanged until October. We'll continue to manage the flow in the way that we are, and that will have a positive impact on our delayed discharges across the system. But there is a wider issue about how we take this forward into the future. This is part of the programme of work that's in the Unified Executive priorities that I talked about last time I gave an update. So it's very much on the agenda for the health and social care system. So I just want to give some reassurance that at the moment we are continuing as we are, but also to recognise there is some further work to do around identifying how we'll fund it into the future. One of the other areas of focus for our work at the moment is around a review of the Better Care Fund. So the Better Care Fund is the flow of resources from health into social care to support things like rapid discharge through all the programmes and activities that we do across the community to help support people to maintain their independence, as well as supporting some of the specific programmes within social care and protecting delivery of social care. That's worked really well, the BCF within Berkshire West. It's recognised it's been very effective, but we are required to review our approach to BCF on a regular basis. So we've now started that piece of work. There's a scoping document that's been completed to articulate what that review will look like. All partners across the health and social care system will participate in that review. And it is intended that the outcomes of that review will be reported to the Unified Executive in the autumn to look at how we might deal with the programmes and projects that are in the BCF differently. So there isn't an intention to reduce the envelope of resources or the capacity or the activity within the BCF. This is just about making sure that what we are doing is still giving us the best possible bang for our system-wide resource investment into what we do. But it will probably be of interest to this board to see what the outcomes of that will be, and what the changes, if there are any, will be to the way in which we're going to deal with the BCF going forward. As I mentioned last time, there are a set of priorities that we're calling flagship priorities for the ICP. At the last meeting of the group, we signed off all the project plans and programme plans for those priorities that are to be delivered over the course of the remainder of this financial year and into the new financial year. I won't reiterate what all of those things are. I talked about them to some extent the last time I gave an update on the work of the ICP. But what I would like to propose to the board is that for future meetings, what you now start to do is to consider the detail of what's being delivered in some of these programmes on a cyclical basis, and that you take them in turn just to see how they're being delivered, what they're doing, what the outcomes are, and how that impacts on the work of the Health and Wellbeing Board. So that's the most recent update, Chair. If there are any questions, obviously I'll take them.
Thanks. I think I would comment with my previous portfolio hat on, looking at Councillor Stewart, that DTOC, delayed transfers of care, is a major KPI for adult social care. So anything that can be done to enhance discharge, but reflect that we're saving the NHS money by getting people out of hospital. And there's a bit of continuing healthcare in there as well, is a good thing. I'd certainly be interested in understanding. I've never quite understood the Better Care Fund. I don't actually know who does fully understand the Better Care Fund, but I'd be certainly interested in understanding more about that. And I think the idea that we take an opportunity to drill into specific items on that agenda from time to time is a good one. That's my personal view. And I'm happy to look for any other one, but otherwise I will take it, I think, from as Chairman, that yes, that's a good idea, Andy. Let's do it. Unless anyone wants to demur, I see nobody itching to speak, so I'll move on. Thank you for that, Andy. So we now have the forward plan. Members, you have the forward plan in your pack. I'll just pick up a couple of things, but as I said last time, if you have specifics on the forward plan when you see it, please come to me, come to Gordon, and we can then pick up those items for discussion, because to some extent, if we want to discuss things that are on here, we may need a particular individual to come in and talk. Members, on the forward plan for September, the last item is relating to defibrillators. That arises out of the promise at Council for this board to review the motion that Councillor Abbs made regarding the motion was to do with use of defunct BT phone boxes, but I think we're going to expand that into the question of defibs for the entire district, because my research indicated that BT only had 2 remaining telephone boxes that might come up for purchase for £1 by adoption, it's called, by local by locals, by the parishes. So in fact, this is going to be more of a question of do we want more defibrillators? How do we fund that? And where do we site them? And who do we engage with in the parishes to progress that one? There's also an item, just to mention, there's an item on suicide prevention strategy that is proposed for September, and that there are the 2 ongoing developments in the acute trusts. Royal Berkshire, with its proposals that are coming forward for redevelopment of the Royal Berkshire Hospital, whether that is on Craven Road site or on another site or on a combination. And also that Hampshire Together are doing a similar, they're slightly more advanced in the Basingstoke piece, and that may be coming forward. However, I do also know that there is a piece around that, just for information, joint health overview and scrutiny across the authorities, and I think there's an invite into our health scrutiny committee to become involved in that. I've left that with Councillor Rolls as chairman. As I say, I'm not going to interfere at all with what Health Scrutiny wants to get up to. So I think she's looking at that in terms of attendance at JHOSC meetings for Hampshire. So Andy.
Thank you, Chair. I just wondered whether it would be possible to, based on the update that was given, to add the rapid community discharge programme to the agenda for the September meeting, as that will be at the point where decisions will need to have been made around whether we extend the programme or not, if you'd be willing to do that.
I'm happy to take that advice. And Gordon, can we make sure that gets its way onto the forward plan? Mike.
Thank you. I just wanted to comment in relation to the Hampshire hospitals. I do think it's important that somebody from West Berks Council is actually represented on the Joint Oversight Board, because 20% of patients at Basingstoke Hospital has actually come from West Berks. And although obviously there's a lot to do with the Royal Berks redevelopment, we don't seem to be quite as involved in the Hampshire one, which could have quite serious effects for residents of West Berks.
But I think I'd just comment back. I have certainly personally been to 2 meetings of Hampshire Together to engage with them, not particularly as a representative of the authority, but as someone who at the time was Adult Social Care, was interested in the health agenda. And because I'm a governor on both Royal Berks and Berkshire Healthcare, was taking an interest in what Royal Berks are up to, and therefore I took an interest in what Hampshire were up to. As I say, Council Rolls has that question that came through Health Watch on her plate, and as far as I know, she is going to. I don't want to put words into her mouth, but I think she will be attending on behalf of West Berkshire. But as I say, that is very much a matter for the Health Scrutiny Committee to decide, not for us. But I'm sure something is being done on that front. Kamal.
Thank you, Chairman. Just to mention that the conference is on the forward plan for the 15th of October, but I forgot to mention when I was talking to the board that if there are any areas that you would like to see addressed on the agenda, please could you let myself or Gordon know, as we are working on the content of that now. If you don't mind, I'll bring it back to the September meeting.
Oh, absolutely, and I think it's a placeholder at the moment, and will expand as we get further forward and towards the conference and decide precisely. I mean, we've already discussed in some general terms what will be on the agenda, but as we get more precise stuff, it'll go into the forward plan so that we have individuals, lead officers with particular responsibilities. Nobody else? Okay, let us move on. We move on now to matters which are for information only. So unless anyone wants to raise their hands, I am going to take together items 15, 16 and 17. That is the renewal and recovery and renewal strategy, the Health Watch annual report, and a letter to consultees on draft statement of gambling principles, which I happen to have had some involvement with on the licensing committee. But members, unless anyone wants to raise anything on any of those, I will take those as information. And I move now to item. Let's just make sure because I'm looking at an agenda I'm looking at a thing which is leaping around. 15, 16, 17. Yes, I'm not missing any numbers now, Gordon. Well done. Item 18 is member questions. Gordon, have we had any member questions?
We haven't received any.
Okay, so we now, members, move on to future meeting dates. We have those in your pack. You also have the date of the Health and Wellbeing Conference in your pack. So unless anyone's got any burning issue they want to raise, I am going to close the meeting and thank everyone for their attendance and ask everyone to stay in the virtual room until we have been told that streaming has stopped. Thank you.